one's forwards?
Just the right one.
So the mouse here?
Oh, okay.
Yeah, left, forwards, right.
Okay, thank you. Good afternoon, everyone. My name's Emma Stanford. I work in Indigenous Eye Health at the University of Melbourne. It's a pleasure to be here this afternoon, and thank you very much for joining in this session. So I'd like to start by acknowledging the traditional custodians of the land where we're meeting today, the Larrakia people. Thank them for their warm welcome to this conference, and also acknowledge elders past, present and emerging, and other Aboriginal and Torres Strait Islander people in the room and with us at the conference. Certainly been a powerful morning and lots of interesting discussion today and throughout the other days. This is a pitch session, which I understand to mean I'm meant to talk for about 5 minutes, and then I'm really wanting some audience participation. So I thought I'd kick off before I do my quick 5 minutes on trichiasis to ask a show of hands, who in the room has had an eye examination in the past 2 or 3 years? There was a nice message this morning about looking after yourselves in order to look after the people that you care for, and I thought there's a bit of a message in that aeroplane OH&S they go through at the start of the thing, where it says, fit your oxygen mask before helping others. So that might be something to think of, setting a good example for your patients, making sure you're looking after your eyes as well, which is always a good thing to do. So I'm here to talk about trichiasis, and trichiasis is really the end stage of trachoma. And I gather there's probably people in the room that know something of this, but it's a interesting disease because it starts in young children, and it's really about repeated reinfections. And the research sort of shows that we're estimated children need around 150 to 200 reinfections of trachoma as children up to the age of 10, so about 1 a month, in order to go blind as an adult. Australia is the only developed country in the world that has trachoma still, and we're really working hard to eliminate it. Australia signed up to the World Health Organisation goal to eliminate trachoma by 2020, and we do that following the SAFE strategy, which I won't go into now, but there's a whole lot of work in partnership with communities and all around these different aspects of the SAFE strategy. And reflecting on what it means to be part of this work, I guess, there was an interesting quote from one of the team leaders in the Northern Territory Trachoma program a few years ago, where she started out her induction at the start of the year with her new group of nurses and other practitioners who were working with her, and said, there's not many times in your life where you get to work on the elimination of a disease. And that's where it's, I guess, the really exciting bit. It's also challenging, and we're getting close to the end now, we hope. So this is what we're talking about in terms of trachoma and trichiasis. So the test for trachoma, it's done as a sort of public health measure where lids are flipped on children to look for the disease, which in that top left-hand photograph is, you can see there some follicles under the eyelid, and that's actually the immune response to the infection. They cause the formation of those follicles, and the sort of a simplified grading that's been comes from the WHO, that if you see 5 or more follicles under that eyelid, that child has trachoma. It progresses on with these reinfections, and that's all around the infected secretions. So the eyes and the nose, the snotty noses, mucky eyes, mucky faces being passed from one child to the other and reinfected. You end up then with some inflammation, and then the scarring, and then ultimately in adulthood, which is sort of over the age of 40, you're ending up with trichiasis, which because of the scarring, you're then it's distorting the eyelid and pulling it in. And if you've ever had an eyelash in your eye, you know how uncomfortable that is. We're talking here about eyelashes scratching on the front of the cornea and people going blind from that. It's a preventable disease. It shouldn't be in Australia, and that's why we're doing everything we can to eliminate it, but we really need your help. So there's a whole lot of work, as I said, going on around trachoma. There's data collected and state teams that go out and find it. It's primarily found in sort of the central desert regions of Australia. There was a much wider area where it was found, and 100 years ago it was found in Melbourne and Sydney and all over the place. But as sort of living conditions and hygiene's improved, trachoma slowly disappeared, and we're really trying to get rid of it in the last few hotspots there. Now, the pitch today is that we really need to be on the agenda of GPs, and that's for looking for the trichiasis in the late stage. So we're hoping to, as I say, we're working hard to eliminate trachoma, and you probably won't necessarily see it in your clinics or come across it, but you might end up caring for people who grew up in trachoma endemic areas, who may live in any parts of the country, and so you really need to be aware of it. So we've got a card here which my colleague Mitchell might send around to people. We call that the 3 T's for trichiasis, but there's also that MBS 715 health check, and there's some information on there. So even one eyelash rubbing on someone's eye is known as trichiasis, and they need to be referred for surgery to an ophthalmologist who can correct that. It's not 100%, but you can actually prevent them from having that scratching causing that damage. And once that damage occurs, then nothing can be done. That person is blind. So that's what we're obviously trying to avoid. I was interested in the talk earlier about diabetes, because Aboriginal people with diabetes need to have an annual eye exam. So Aboriginal and Torres Strait Islander people with diabetes need to have an annual eye exam. So you should be seeing all your patients with diabetes. You should be doing this eye exam, and in fact on the back of this information, there's information about the diabetes item number. And I'm pitching to you that while you're thinking about diabetes, don't forget about trichiasis, and keep an eye out for that. So as I mentioned just before, we've got the 3 T's for trichiasis. It's really a simple measure, reminder to think about it, to use your thumb to lift up the eyelid, to have a look in there and use a torch, because it's often dark and it's hard to see. Now there's plenty of training modules and information and things around. We've got some revised training modules on the RARC website, which is the Remote Area Health Corps. They provide lots of training resources which are available free of charge to anyone, and there'll be a new updated trichiasis one any minute now. It's just having its sort of final stages. But even Milparau Trachoma Garana has had his eyes flipped lately during a training session with some of the people in WA. Now I also wanted to pitch that getting people interested and aware of these things early is a really good thing, and I was lucky enough early in September to be out in some WA communities where the WA trachoma team was out doing some screening and treatment, and they've actually had a program over a number of years since 2008 where about 80 students from Notre Dame and also from the Rural Clinical School have had either 2-week or 4-week placements, and they get that exposure to a public health and also to remote Aboriginal communities, and also learn a bit about trachoma and trichiasis. And I think that's also a great way to for people to gain an interest and think about working in Aboriginal health. So my pitch, I guess, is that we can eliminate trachoma from Australia, but we won't achieve this without your help. We actually need to show to the dossier that we have to put into the WHO that we have a sustained program where trichiasis is checked and monitored, and then there's follow-up surgery for the next however long, until we make sure that there's no one that goes blind from trichiasis in Australia. So remember to think about the eyes when you're doing the 715, look at diabetes, and also the 3 T's for trichiasis. And I guess now we'd sort of switch over to ask if anyone's got any questions, and otherwise move to the pitch session.
Hi, I'm Michelle, and I'm in Catherine. And until just a few years ago, we would routinely screen for trachoma with our school screening program, and now we don't. Is that a fair call, or are we being negligent, do you think?
No, I think you're actually done well, and you may be off the list in that area. So that's a good thing. That's what we're trying to move towards. But I can talk to you about it later if you want to follow up. You're in Catherine itself at the school, primary school, I'm assuming. Yeah. Were there any other questions? No? So I'm just wondering, how do we keep things on GPs' agendas? You're busy people, you've got lots to think about, and what I guess we're trying to do is eliminate trachoma from Australia, and we're hoping that you never see it. But, you know, occasionally you might. So what's going to trigger in your mind or remind you that you've got to look out for Aboriginal people potentially with an eyelash rubbing on their eye? Does anyone want to kick that off?
I'm Laura. I'm working in the Catherine ED at the moment. Maybe I was thinking it could be a good thing to put a poster or something in the eye room near our slit lamp, because that's the room where we're doing most of our eye examinations in the hospital. And, you know, I guess that's for people that come in with an eye problem, but, you know, it might help prompt us to consider it as well.
Thank you. We've got resources that we've sent out to clinics, which were actually developed many years ago in Catherine West with the Norman Reference Group through the Catherine West Health Board. But we probably have not necessarily targeted, you know, clinic rooms in hospitals, which is a good thing. And we've got these sort of 3Ts and other information. We could easily do that. Thank you. Other suggestions?
Hi, I was just wondering if you do education sessions with GP registrars in high-risk endemic areas. Do you offer that service? I'm a medical educator in the Kimberley.
So we haven't as such done that, but, and I'm not sure about the state trachoma teams, whether they do, but it's another good. So do you have sort of localised registrar training where there's a few of you?
Registrar workshops and those sort of things.
And I'm sure you've got a lot of things on your list for those.
Oh yeah, but a lot can be achieved in 20 minutes, as we know with any GP consult. You can get a lot done in 20 minutes, but even via VC and telehealth, those sort of education sessions make it a national thing.
It's a great suggestion, thank you. Anyone else got a suggestion?
Have you targeted nursing staff?
Oh, that's right. Just like involving the nursing staff and the optometrists, I'm sure is something you've already.
So yes, we do that, and the teams, when they're out doing the screening and treatment, they obviously work in with the clinics, which are often staffed by nurses, nursing staff and things. But you're right, you've got to try and get to all the different health professionals, Aboriginal health workers, and through the AMSs or ACHOs as well, and the nurses too. Dentists. Yeah, well, funnily enough, we've actually got on our 5-step hygiene routine, which is something we do in our health promotion with schools and early learning settings. We've got stop trachoma and other infections, and it starts with blow your nose with the tissue until it's empty, and that's actually more the otitis media sort of ear health link, if you like. Wash your hands with soap, wash your face whenever it's dirty, don't share towels, and brush your teeth twice a day with toothpaste, which is the dental side, and then on the back we can put all the different other infections that's related to dentists. And I guess the other thing in your clinic, one other pitch is that we go around and talk a lot and do lots of programs with communities and things about good hygiene. And I do notice, I think there's that opportunity when families come into the clinic, for instance, to say something about if there are, children with snotty noses and mucky eyes, there's a chance to say, how about you blow your nose, how about you wash your hands? Because what we really want is everyone reinforcing those same messages around the importance of good hygiene, and it just being the social norm to have a clean face rather than the social norm to have a dirty face. You had another question?
I was just going to add, in the Aboriginal Medical Services, we mostly use templates to do our 715, so I think how it's embedded into the template and whether it's a red dot that has to be completed in order to complete your health check can impact on whether you do it or not.
Yeah, it's not, is it Mitchell A? It's not a requirement that you have to do it, the eye check, before you can go. But it's not it's not always done. So we're trying to sort of raise that awareness, but it's a good point. Now I've just got, if we've still got a minute, I have got a video which I thought might be a nice way to finish off one of our art mural projects that was done in Papunya in the Northern Territory. This is some of the, if you like, the fun stuff we get to do working with community, trying to raise awareness about the importance of clean faces and good hygiene for trachoma, and also learn about culture. So.
Hi, my name is Lauren Jeffs. I work for Indigenous Eye Health. We've been in Papunya this week working on an art mural project and also delivering hip-hop workshops.
My name is Panada Stockman and I live in Papunya, and I work for Department Children and Family Service. The honey ant is important. It represents a Papunya community because it's honey ant streaming.
The best part of the week is seeing all aspects of the community working together to deliver the project, which is behind me. It's been really great to see so many community members have a really deep connection with the honey ant dreaming and, use what makes Papunya great to help deliver the health message about clean faces, strong eyes.
That message is it's called Kurupalla, cleaner Kanyitaku, to keep it clean. Good to teach that trachoma is here to help kids to understand, like to keeping their face clean and to keep the eyes strong.
The community has seen the wall grow from a blank wall through to what it is today, and people have given lots of feedback on the mural. A lot of people have been really touched and had quite an emotional response when they've seen it. A lot of kids have a huge smile as soon as they see it, especially seeing Milpa. A few teary eyes as well, which has been really lovely to see.
It's make us feel, happy for what the ladies have been doing now.
It's been great working with them, seeing that process and seeing grow through this week, and feel confident in using their ideas to help deliver such an important health message.
The community, the locals, they it's lovely on the wall. We've seen the honey ants, and it's looked great and it's fantastic. Yeah.
Thank you. That's a time.